This summer, I had a routine visit with my family doctor. I asked to have my ferritin checked because I was taking iron supplements and was curious where my levels are at. Ferritin is a marker of the amount of iron that you have stored. So she also did a few other things since I was already going to be poked anyway. Turned out my creatinine level was high, and so she started to worry about my kidneys. The thing is that I had done a medium long run the day before the test, and this was in the summer heat. Alan and I were already well into Pete Fitzinger and Scott Douglas's advanced marathon plan.
Oh God, I remember that.
Normally, I would be worried about this test result since we need our kidneys to live. But in today's book, I learned that reduced blood flow during running, dehydration, rise in body temperature, and muscle breakdown could all be factors in my slightly higher than normal test results. So I'll have to repeat the test to make sure everything is okay, but I'm not worried. Hi, and welcome to the Running Book Reviews podcast, where we review running books to help you decide if you would like to read the book for yourself. We also hope that listening to us chat about running can help keep you motivated about your own running, or maybe inspire you to try something new. My name is Liz, and with my co-host Alan, we are going to talk with author Dr. Juliet McGrattan about her book, Run Well: Essential Health Questions and Answers for Runners.
So a little bit about Run Well. This book is a sort of question and answer format with a short introduction for each chapter based around what system we're talking about. So the questions are grouped into chapters based on body systems, starting with the head, ending with the overall subject of self-care. Chapter introductions include drawings of relevant biology that you can refer to if you need to. So you get little simple biology lessons so you know what's happening to your body. Throughout the book, there are real life runner stories, sort of did you know segments, and summaries of things to try as well. So little practical tips and tricks. And at the end of each chapter, there are also resources that you consult if you want more information. So let me tell you a bit about our author, Dr. Juliet McGrattan. She's a medical doctor, has worked in, GP medical practice for years and years and years. Is now an author and runner. And Run Well's not her first book. She wrote her first book, Sorted: The Active Woman's Guide to Health, in 2017. And it won first place at the British Medical Association Book Awards. Wow. These accomplishments alone are extraordinary, but Dr. McGrattan is also an international speaker, a freelance writer, a podcast host, founder and director of 261 Fearless Club UK. Maybe we'll find a little bit more about that. She's a master coach and women's health lead for the 261 Fearless Global Women's Running Network and has appeared on national television and radio. Welcome, Juliet.
Thank you very much. That was a nice introduction. It's lots of hats.
Oh, hope we didn't miss anything with all of that.
Well, I guess we can add in the 3 kids and a dog and all the other things that go on with a busy life.
Which are often the most brilliant accomplishments and achievements. Yeah. And she has 3 kids and hasn't gone mad yet. I know that because I have 3. So what inspired you to write this book? You're obviously well qualified to write it, but what inspired you to do this?
Yeah, I think as I was growing up, my dad was always really good at explaining things to me. He would lie down at bed at night next to me. Instead of reading me a story, he would tell me about how something worked. And I remember him explaining how televisions worked and how radios worked. I don't think he could now explain how the internet works, but in those days, I just thought it was amazing. And the way he used to break it down and get the information across to me was in a way that I could really, really understand it. And I really developed this sort of love of learning through medicine as I was doing as a career, but actually trying to make things understandable and put them really into context for the person that was listening. And when I had my running journey, I didn't start till quite late. I was in my 30s and I really knew nothing about running. I knew a lot about the human body, but I didn't know anything about running. I didn't know what shoes to get. I didn't know how to start a training program, etc. And as I went along that journey, I realized how much medicine there was with running, and how, as a doctor, I had absolutely no idea how to answer the kind of medical related running questions that people would ask me because I was a doctor. So as I came across these problems, and as people asked me these questions, I really saw that there was a need to break things down, to explain them, to make them understandable, and to make something that was really useful for runners. You know, doctors are really busy, and here in the UK, you know, you don't really want to go and bother them. People would say, oh, I don't really want to bother the doctor. But if there's something that's stopping you running, stopping you do your hobby, stopping you keeping fit and healthy, then, you know, those questions are really important. So I just wanted to, create a little resource that runners could turn to, where they would get some information and, if necessary, get some signposting. They may not get all the answers, but they would know when they should go and seek sort of further help. So that was my aim. I hope that I have achieved it.
I think there's a general, it's probably a bit of a joke, but people say in the running club, oh, don't go and see your doctor. They'll tell you to stop running. And that's useless advice. That's because we're not going to follow that. So there's always kind of that sort of joke that doctor's going to give you the wrong advice, which is, well, if it hurts when you run, don't run. Oh, duh. We're not going to do that, because runners are somewhat focused, and they're always looking to give me some advice so that I can keep running.
Yeah, and I didn't understand that when, as a non-runner. I didn't understand how intrinsic running becomes into your life and how important it is for you to cope with life and perform well in life and manage all those other things you're doing. So I didn't really see how much of an issue it was if you told somebody not to run. Just go and, I don't know, go cycling, go swimming. I just didn't really understand that until I was a runner. I think it does depend on which doctor you go and see. Certainly, in the practice that I was at, the doctors were all very active, so they would be very unlikely to give you that piece of advice. But there are many doctors who have very, very little training in any kind of sports related medicine. And that's not their fault. That's just the path of training that they've come through. So there is that risk. Sometimes you do have to be strict with a runner, and you do have to say, it's really not a good idea that you run for X number of time, but at least you have an understanding of the impact of those words. I think you're right, Anna. They just, it's a joke, but it's not a joke.
So how did you end up collecting all these questions? Because I mean, there were a lot of questions, and some of them are sort of like very common, others are not so common. And I'm sure there are some questions that maybe didn't make the cut. So how did you kind of narrow it down? And how were you collecting all of those questions that ended up making it into the book?
Yeah, sure. So I definitely collected my own questions. I took myself right back to the beginning of my running journey. What didn't I know? Because I think you very, very quickly forget what you didn't know. So I started right back at the beginning of my running journey and tried to remember what I wanted to know, what I was looking up. When I was fairly early on in my running journey, but quite passionate about running, I started writing for Women's Running magazine in the UK. And my role there was to answer reader questions, those that were people that were reading the magazine or the website, etc. So I did get asked hundreds of questions over the years through that role, and that's a role that I carry on with. And also I was helping out at UK Run Chat, which is a UK sort of running community online, and I would have questions coming from them. Then some of the chapters, I would do a little search online, and I would look in the forums, and I would see what are people asking, because there are so many running forums. Quite worrying when you saw some of the answers, because not always the best place to go for medical information. So that's how I did it, and I just worked my way through each system. I had friends, running friends, who read the book before it was printed, etc., and commented if they thought there was a question that should be asked a different way, or there was something else they thought of. So friends, family, runners, online, magazines, everything, just putting them all together. I know there'll be things that I missed, and I already think of things, I should have put that in. But you can't, I'm never going to answer everything, but I've had a pretty good stab at making it as complete as possible.
I suspect you have, because one of the things I started doing as I was reading the book was thinking about the things that I normally ask, like, oh, I've got a headache after the run. You know, what's happening? Do I have a brain tumor, or is it normal? Those kind of things. And I found that, everything that I sort of would generally think of normally I think people go, oh, my knee hurts, or you know, some muscular problem or something, but also all the other things around running that I could think of, they tended to pop up.
Good.
Even some of the anecdotes, I noticed that you started to throw in, did you know, kidneys can filter how many liters of water or whatever. And I thought, aha, because I'm come from pharmaceutical training, I did biology, and I know a few of these stupid did you know things because I'm a guy and we collect useless pieces of information. And I thought, I'll bet she doesn't have, did you know if you fold out your lungs, they will cover, the surface area will be the same as a tennis court. Juliet will not know that. And sure enough, you had it there on one of your did you knows. I thought, God damn, the woman's a genius.
Oh, well, I did get caught out when a guy at my husband's running club said, I was thinking about buying your wife's book. Is there anything in there about bunions? So he came to ask me, because I don't think he's read it yet. Is there anything in there about bunions? And I was like, no, there's not. But, maybe I need to have things to put in a second edition.
Either a second edition or maybe an appendix.
You
just add all the things we think about while we're having this conversation, maybe.
That's right. I'm sure we'll come up with extra ones that aren't in there. And, I had to research a lot of things because, yes, I knew the answers to lots of these questions, but I really wanted to make sure that the information I gave had some evidence base to it and wasn't just from one small trial that was done, somewhere in the world, that did actually have a good base behind it, which sometimes meant that it wasn't easy to answer the question, or there wasn't necessarily a right or wrong answer, because a lot of the time in research, you don't come up with a solution. So I needed to be quite honest. And I've tried to carry that all through my medical career, really. If there's something you don't know, you say, I don't know. Or if the evidence isn't clear, you give the pros and the cons.
And that's why people should buy this book and not go Googling things. Because this book, if I can just get on my own hobby horse, this book has all the research behind all of the responses. In fact, the articles are all listed at the back, and you can be confident that the responses are based in some factual science, as opposed to asking Mr. Google, and then or asking the guy you're running with, then you get the opinion of the public opinion rather than the research-based answer. So you can be confident in what's being said in the book, given that it comes from reference articles that you list at the back.
The first section was the head, and you included like mental health related questions. And one of the things that we actually hear runners say a lot is how, well, running is, that's how they deal with mental health. And it seems like, well, running is their antidepressant kind of thing. So does running really help mental health? And does that mean that we don't need medication?
Yeah. So, I mean, with my former, because I'm not practicing as a doctor anymore, but with my former GP hat on, I would say, please don't stop your medication without speaking to your doctor. I think it's always important to say that. But we do know, and we're beginning to understand more and more, how powerful exercise of all types, but particularly running, is in terms of boosting and maintaining good mental health for so many reasons. There's obviously the chemical changes that go on when you're exercising. So the release of all those endorphins and substances in your brain that are linked to, that are similar to cannabis and to morphine, real powerful drugs, if you like, but they're our body's own drugs. So there are those chemical changes on that give you that boost and that lift your mood or relieve anxiety or relieve stress. But I think with running, it's more than that as well. I think there's the social side. So very often people go and run with others, so you're getting a bit of good social health, which we know is vital for keeping you well. But you've also got the almost meditative effects of running, particularly powerful if you're doing it on your own, and you've got that thud of your feet on the ground, which again gives you this sort of meditative state, which allows your mind to sort of wander. And I think it's that combination of all of those things, including the fact that running can be so good for your self-esteem, because you select a running goal, you select a training program, you work towards it, you succeed, and that gives you a huge boost in your self-belief and self-esteem, and realizing what your body can actually do and something you can have control over. So that wonderful mix of all of those things, and probably more that I haven't mentioned, but I think makes it very, very powerful for good mental health. And in terms of medication, there are some studies that show that vigorous exercise like running can be as effective, if not in some of the studies more effective, than an antidepressant. But I think interestingly, there are studies also that show it can sort of augment or increase or boost the effect of antidepressants that people are taking. So whilst I don't think it's a panacea and it's for everybody, and people with depression still need to see their doctor, and severe depression still do need treatments, it can be a really great tool, a really great add-on for keeping you well and for sort of helping you if you are struggling with your mental health. Definitely and I think I started running for the physical effects and the physical health and benefits, but actually when I realized the mental health benefits, that's when I was sold. And that's what keeps me going back. That's what keeps me motivated. It's much more the mental health benefits.
Yeah, it's interesting that you mentioned about the, about the studies on the effects on mental health, because I remember, this is more than a decade ago, I was working in a hospital. It was a rural hospital, and I had heard about one of the psychiatrists. So I don't even know if it was like an urban legend or, because it was just somebody told me that there was a doctor in the psychiatry department that was prescribing to his patients. I mean, they were medicated as well, but he was prescribing to his patients like vigorous activity, 30 minutes, like three or 5 times a week, something like that. So I remember that from like over a decade ago. So it's pretty interesting to now see the research behind it.
Yeah, I think very often, or in the past, exercise has kind of been that small print, that add-on at the end. Certainly in my medical training, you'd learn all about the pharmaceutical and the drugs, and then there'd be and lifestyle at the bottom, exercise. And really, and it's very interesting, in the UK a lot of work has been done on this. And actually I had a job for about 3 years with Public Health England, teaching healthcare professionals about exercise and how to speak to their patients about it, and really trying to reverse that and say, actually, this should be first line. This is what you do first of all, and you look at your lifestyle, exercise being a really important part of that, because we know there's so much evidence now that exercise can reduce so many diseases, can really have an important role in managing pain and all sorts. So really, it's the first prescription that we should be looking at, and most of the time it's free till you start buying really expensive shoes, and the side effects are minimal. And in terms of comparing its effectiveness to a drug, a lot of the time the benefit in percentage that people are going to get, the sort of reduction in their risk, is bigger than for many of the medications that are available. I'm thinking of things like coronary heart disease and reducing your cholesterol and things like that. So really there isn't a good reason why movement of some sort, whether it be moving somebody from being inactive to walking regularly, or getting somebody to start running, that there is no reason why everybody can't do that to some extent.
What I find, in addition to the physical exercise, what I find afterwards, certainly with our running club, and it's probably the same with almost any running club anywhere in the world, is they're kind of reluctant to leave after they've finished their run. They all collect in one place, and then there's chatter going on, or there's a cup of coffee afterwards, or something. And the group is always extremely positive because they've all come back from their run. They're all a little bit buzzed up with the effects of their exercise, and they're usually extremely positive. Usually one of the first things they ask is, "How was your run?" Not like, "Let me tell you about the run I've just done." It's usually validating the other people. And as a social group, they're a fantastic group just after a run. Probably if you met them all as individuals in their workplace, you'd go, "Who are these people?" And you wouldn't want to mix with them. But certainly me, you wouldn't want to mix with me. But after the run, they're a fantastic social group. They're feeling good. and they're positive, and they're often very validating towards other people. You know, I've even met a few people who are sort of semi-pro or pro runners after runs, and you think, well, they'll be aloof and they won't really want to engage because they operate in a different world. But usually they're not. They want to know how your run went, and, you know, they share in the Secret Runners Club credo, which is, you know, everything's wonderful after a run. And that can have a fantastic psychological benefit, I think. It's rare that I would come back after a run and not feel better than before a run.
Yeah, definitely. And that community is what keeps you motivated as well, isn't it? Because you do form friendships, and you do, like you say, meet people that you didn't think you would normally meet in your course of life, and have running in common, and being accountable to other people like that. They're expecting to see you. If you're not there, they give you a shout, where are you? You know, how's things going? And I think that, yeah, creating community around running is one of the things that makes it so powerful. Just having somebody ask you, how did it go? Just like you say, it validates it, and it makes you feel that somebody's interested, and that in itself can be such a small question, but it can really boost somebody's self-esteem and confidence, and keep them coming back, which is the key, because it can be hard, can't it, running?
Mm-hmm.
It can be hard to motivate yourself to get there, but those extra bits and that good social health, yeah, really, really important.
I think also, like, what I find with the goal setting that you mentioned is you know, it's a kind of like a safe place to set goals. I mean, I guess this kind of depends on perspective, because for some people setting big goals is stressful, but in a way, like for me, I feel like running goals, I mean, usually your running partners, they'll be disappointed for you if you don't meet your expectation, but they're only disappointed for you because they know you're disappointed. They're not disappointed in you because you didn't achieve that goal. Whereas, you know, when you set goals at work, it's like you're always held accountable at the end of the year. It's like, well, did you achieve those goals? And so it's a bit more stressful to like not achieve work goals, but these ones are sort of personal. And then if you don't meet them, like Alan and I didn't get our sub 3 hours this year, well, you just reuse the same goal for next year and try again. So it's kind of nice that way.
And also we're pretty cool about saying, oh, we have this target and we're going to go for this target, and then not achieve it and go, oh, we didn't achieve it, but we achieved all the other things. Which was the whole training program, and we got joy and benefit and learning. I always say you either get success or you get learning, and learning itself is success. So
yeah, you don't get failure. You can't fail. and I think that's important, actually. You're saying that about the perspective, because goals can be stressful, and that is something that I do sort of touch on in the book in a couple of places, is that being careful and getting the right balance for yourself, and not letting running become a stressor, because you can, particularly depending on your personality, you can get very caught up in it and start to be disappointed if you don't meet your goals, but actually put a lot of pressure on yourself, and you don't rest when you should rest, and you keep going despite being injured, because you're so relentless in pushing towards those goals. So I think it is important to, you know, always have that healthy perspective, and take a step back every now and then, and make sure that you're doing it because you want to do it, rather than because you feel you have to do it.
Good stuff. Let me just change the subject a little bit. We've got a lot of cold weather here at the moment in Montreal. Surprise, surprise. I've noticed in the club there are a few people who seem to have difficulty getting their breathing under control in the cold weather, and I was fascinated by your discussion on diaphragm breathing in the book. Maybe you could just explain to our listeners what is this diaphragm breathing and how does it help you?
Sure, yeah. So the diaphragm, if people are unsure, is this kind of platform of muscle that divides the chest cavity from the abdominal cavity. And it works with a little bit of suction, if you like. When your diaphragm lowers, it draws air into your lungs. And when your diaphragm rises again, it pushes air out of your lungs. And very often when we're breathing, we're not breathing using that diaphragm to its maximum potential.
So it's like the piston pushing your lungs.
Yeah,
pushing the volume of your lungs out and then sucking it in.
Yes, absolutely. Yeah, that's right. But also when we're breathing, we're using our muscles between our ribs and around our chest to open up our lungs as well. And particularly when you're running, depending on your posture, you can often get quite tense. Your shoulders sort of tend to crunch in, and your shoulders raise up to your ears. And because you're feeling a little bit out of breath, often you tend to really breathe just with your chest, rather than actually being able to expand your lungs to the full. And we want to get as much oxygen into our lungs as possible, because then we're getting as much oxygen to our muscles. So we want to really make sure that we're getting the most effective breath that we can. And actually, simply by taking a little check on what we're doing with our breathing and practicing to breathe with our diaphragm so that we can get our lungs to expand to their maximum, can be something that we're out of practice of doing, but it can make a little bit of difference, rather than purely breathing in our chest, actually breathing into our belly a little bit. So in the book, I sort of describe how to practice that, lying flat on your back with your hand just underneath your rib cage. And as you breathe in, trying to push your belly out, because then you know that you're using your diaphragm and not just your upper chest muscles to breathe. It takes a little bit of practice, and some people get out of the practice, particularly pregnant women, when they've got a big bump there, a big baby bump. They do naturally, because of the way the baby is sort of compressing the chest, actually start breathing a lot more with their upper body. And it takes a bit of time to relearn diaphragmatic breathing. But it is something simple that we can all do. It's hard when you're running along and you're trying to keep your running posture good to breathe into your diaphragm. But with practice, it can actually be done. And it does make a bit of difference to say how much oxygen you're getting in, and keeping your breathing calm as well, because obviously when you're in a nice rhythm, that can be very important.
And I guess in the cold weather here, the chances of you being tense when you start because you're cold and you're sort of crunched up because of the cold just exacerbates the possibility that it's going to restrict your breathing.
Yeah, and some people do find, actually, rather than the diaphragm not functioning properly, but that they're actually, their airways sometimes narrow with cold air. And a little bit in the same way that asthmatics do, and particularly people with asthma can find that cold air really quite debilitating, because they do find that it constricts their airways. A little bit different. It's constricting the actual tubes that the air is passing along and narrowing them down a little bit. That's slightly different, obviously, to not breathing with your diaphragm, but that cold air can affect runners in lots of different ways. Normally, once you're warmed up, it's fine, but obviously, if you have asthma, it can be a big problem, and you sometimes need to increase your asthma treatment during the winter and the colder months to account for that if you are affected.
I actually tried that diaphragm breathing exercise. I guess it's a little bit similar also to what they try and have you do in like, if you've ever done yoga or those kinds of things.
Yeah.
And it's actually pretty hard. I mean, my hands don't go up and down very much. And like, I'm really trying to, expand my stomach so that, they go up and down. And it just, I think I'm very much like a upper chest breather, like you mentioned.
It does take practice, definitely. So even if you're sitting at your desk or sitting on the bus, or if you watch a baby, especially like a newborn baby, and you watch them breathe, you'll see their tummy up and down and up and down, and that's what we sort of lose over time. I think partly from maybe is being seated a lot as well. When things are more constricted, you have to have a good posture to be able to do it properly. She says sitting up while she's
yeah, I'm gonna sit up straighter. Maybe it'll help. The other thing that I notice a lot when I run is my nose runs, especially in the winter. I feel like as the weather gets colder, I get instantaneous runny nose when I go outside and the wind blows. Why does this happen? And is there any way to prevent it or help it not happen as much? Or
Yeah, sure. It's a really common problem. And, people have lots of running friends who always say, oh, I need a tissue, or they just got a pair of gloves and they're just wiping their nose. And it is more common in the cold air, can be common, sort of linked into hay fever type things as well. And this is really because of the lining. Well, it's a kind of a few things, really. There's the airways. I don't know if you've heard of the word rhinitis. Itis, if you stick it on the end of anything in medicine, it means sort of inflammation. And rhinitis sort of does account for all types of runny nose, but there are lots of things can trigger it, and cold air is one of those. And what happens is that the nasal passages tend to sort of narrow, but they also get a little bit annoyed. That cold air irritates them. It irritates the lining of them. I mean, our noses have lots of mucus in them naturally, and, you know, that's to stop dust and pollution and things and germs and things going into our nose. But when we're breathing rapidly, when we're running, we often find that because of the cold air irritating it, you just get an overproduction of the mucus. Those mucus cells that are lining the airways, they get sensitive and they just start producing more mucus, which when they're producing it quickly, it often tends to be much more liquidy than it is normally. So it's a tricky one to solve. Some people don't have it at all. Some people have it really, really badly. And the easiest way is actually just to cover your nose up a little bit when you're running. So, you know, those buffs, or, well, we've got face masks at the moment, haven't we? You know, they literally just warms the air a little bit before it goes into your nose. And that in itself can actually reduce the sort of chances of it happening. The other thing you can look at if you are really badly affected is actually looking if there are any medications that you could use, particularly if it's linked to things like hay fever. Then you might find things like antihistamine sprays or even antihistamine tablets can be helpful as well. But, you know, if it is just one of those things, sometimes it's just one of those annoying things that runners just kind of have to cope with, and we have to get a tissue. But actually, you know, that nasal mucus is there for a purpose. We shouldn't get too cross with it when it's overproducing. It's just trying to help us stay healthy.
Yeah, and I guess my nose runs more in the winter, and I mean, like, the only way to solve that would be just to not run in the winter, which is not really a solution, right, Alan?
You just take your headband, you wrap it around your wrist, and you use it as a nose wipe.
That's it. There's always ways. Yeah, best not to send out a snot rocket, as you see some runners doing. I'm not too keen on those.
Well, not right now with COVID, I guess. It's
absolutely
socially unacceptable.
Keep your secretions to yourself.
I tend to do both, so apologies to my running buddies.
Just as long as I'm not behind you, it's fine.
One subject that comes up that's near and dear to my heart is alcohol, in particularly beer. We were actually out last night. The club had a run. Shout out to Phoenix Runners Montreal. Not only did we have a run, which is wonderful in itself, but we had a run which finished at a microbrewery that we associate ourselves with. And we went to trivia night there. Thanks, Troy, for the trivia night at La Brosse Microbrewery. I always mention La Brosse Microbrewery because I figure if I do it often enough, they'll give me some free beer.
Yeah.
So everybody had beer afterwards. Everybody except Liz. Except Liz. Liz has what, ginger ale or something?
I had ginger ale.
Oh,
I did have pizza
person.
though. No. I had the better beverage.
I guess we all know that beer's kind of no good for you. In the ultimate scheme of things, you get some effects, but not many runners are going to give up beer, I don't think. So all of that is just an intro to ask you, tell us about alcohol consumption. What should we do? What should we not do, particularly around key races or hard training?
Yeah, I found this quite a challenging question to answer in the book because I really didn't want to sound preachy. And, you know, I love having a drink as well. And that, like you say, that social side after a run and going to the pub, or I liked having a glass of wine with my friends. So I didn't in any way want this to be, you know, didactic. You need to do this. And, you know, it's not my position to tell people what to do. But when I was looking at it, it was actually really hard to find any positives when it comes to alcohol and running, other than if the social side, and also if a small glass of something the night before an important race helps you to relax and makes you sleep a little bit better, then potentially you might get performance gains from that. But other than that, it was really hard to find anything that was positive. And I think if people are looking for, you know, marginal gains in performance and things, then they really do need to look at their alcohol consumption and see if changing that makes a difference. You know, when it comes to those really marginal gains in terms of getting your speeds and your times and things, then you're looking for all sorts of things that you can do. And it's difficult really to say that alcohol will help you to get those. You know, so many ways it can affect. You can affect your sleep. you never sleep with as good sleep quality. You might sleep for the same length of time, but you never sleep with such good quality after you've been drinking. And sleep is when your body repairs itself. It's restorative, and that's really, really important if you're following a training plan and you want the best out of your performance. We know that it can actually, rather than just affecting the sleep, it can affect your recovery in wider ways as well. Your body is trying to restore itself, repair everything, and the alcohol is not going to help with that process. And more than that, it's rare, unless you have a little bit with orange juice, it's very rarely going to contain any vitamins or minerals that will help with those repair processes. It's kind of empty calories, if you like. There's lots of other things that you could be drinking or consuming that would be more beneficial, maybe not as enjoyable. But after that, I think it really depends on how much you're having and how you're using alcohol. I'm not sure in the States what the guidelines are, but here the guidelines are that you shouldn't binge drink. You should spread out your alcohol intake. And if you're having excess alcohol, it's definitely going to have a negative effect. If you're having a moderate amount of alcohol, then it might have a negative effect. And a small amount is unlikely to make a difference. So really, it's how you drink and what and why you're drinking. And the odd drink with friends isn't going to make a big difference. But if you're drinking excessively, that can even impair things like your immune system. And if you're wanting to stay well and you're wanting to be fit and healthy on your race day, then you want to do everything you can to try and improve your immune system. And then if you're drinking and then running soon after you've been drinking, or maybe even the next day, then you really need to think about the immediate effects it's having on your body rather than just the long-term effects. So actually making you dehydrated, affecting your blood sugar. It can lower your blood sugar and make you less able to perform if your blood sugar is a little bit low. So I think it's all about being safe, but it's all about moderation and being sensible. But if you are really looking for those marginal gains, then you probably do need to think, is my relationship with alcohol affecting my performance?
I certainly don't drink. Liz doesn't drink at all. She would just do the chapter, alcohol, don't drink it, end of chapter.
Full stop.
I certainly don't drink very much, and I think all the runners who like beer tend not to drink excessively, and we all tend to have a sort of a credo of, okay, well, the marathon's coming up, the event's coming up, or whatever, need to have no drinks for a period of time, and then we argue about what the period of time is.
Yeah.
So if you're a light drinker, let's say, and you're looking to abstain from alcohol leading up to a marathon, for how long should you abstain?
Well, it's interesting because the alcohol doesn't stay in your system that long. Each unit takes about an hour to get broken down by the body.
Well, so you can have a beer at breakfast time before the event.
If you. But I suppose the effect is, if it's affecting your training, then ultimately that's going to affect your outcome on race day. So when you taper, you're cutting back on your training. So maybe although the kind of trend is that 3-4 weeks or whatever before you cut down, or the last 2 weeks you don't have any at all, I suppose that can be boosting your immune system. But in how that's actually going to benefit your training gains, you might be actually better at looking at reducing sort of earlier on in your training plan. So difficult question to answer that one, and different for every person, because obviously everybody metabolizes alcohol a little bit differently as well, and some people are more affected by it than others. The chief medical officer's guidelines here in the UK are that you should have no more than sort of 14 units a week for men and women, and that's about six. I think that's about 6 pints of beer. So it's still quite a lot for, per week. So I think you can stick within those guidelines and still feel like you're not affecting your health negatively, but you could be getting more benefit from your running if you cut back more. But as I say, I don't want to sound preachy, because I think everybody finds what works for them, don't they? And it's a very personal thing.
Yeah, I guess just anecdotally, what works for me is I always find a sleep effect for any amount of alcohol. So I had like 1 unit of alcohol. I had two small beers last night, and this morning I feel like not as well rested as as normal. So I go, okay, if I'm doing a marathon, the sleep that's vital is the 1, 2, and 3 days before the marathon,
Yes.
because it's not the night before. So I need to have at least 3 days, and just to be safe, 5 days. So I usually go 5 days, no alcohol whatsoever before an event. But that's just my personal approach.
Yeah.
No scientific reference articles available.
Yeah, and I have a friend who did her first marathon full on training plan, and had no alcohol for the whole time during the plan, because she just wanted to see what was the best that she could do on the day. And that she did that. I guess for her, maybe it wasn't such a big deal to cut it out, but yeah, I think we're all different. I was better the first marathon that I ever did. I think I took it pretty seriously and really cut down. And on subsequent marathons, probably less so, to the point where I would have a glass of wine the night before just to relax me. And what I do find now, though, is, being nearly 50, is that if I have more than 2 units of alcohol, I'll wake up with a hot sweat in the night because of menopausal symptoms. So again, like you say, I know that's going to make me not feel great the next day. And so I think you can look at it in all different angles. But yeah, it was hard to find many positives.
Oh, well, I guess that's that just means that I'm in a good place, not
You're
liking
just looking
alcohol.
smug now.
That's right.
Yep, I feel like I'm helping my performance every day that I don't drink. So since we're on the subject of performance, there was a section about giving blood, and I remember when I was 18, I gave blood for the first time. I don't know why it was such an event for me, but I thought that, I wanted to do my part. And there were always these ad campaigns about how, blood donations are needed. And then after that, I think I only maybe gave blood one other time, because oftentimes I would show up for the blood donation, and they would always do like a little skin prick to check your iron stores, or I'm not really sure exactly what they check. And I was never high enough to be able to give blood. So eventually I sort of gave up on that. And recently, because of the pandemic and everything that's been going on, we've been hearing those ads again about how important blood donation is, because blood donations have been down because of the pandemic, but the demand is up. So, I know also that getting a pint of blood removed is going to affect my performance. So how do you recommend that I go about giving blood? Or if I give blood, is there a better time of year to do it than other times of the year?
This is a perfect example of a question that you think a doctor would know the answer to, but I didn't. I do now, obviously, but as a doctor who wasn't a runner, somebody would come and I'd ask me this, and I wouldn't have had a clue. And this is a really common question for runners to ask, because like you say, they want to do the right thing, they want to give their blood, but they don't want to give up. It's the red blood cells really that are the important thing here. When they're doing your skin prick, one of the things they're looking at is what your red blood cell level is, because if you are already anemic, then they don't want to take blood away from you. You've got to have your red blood cells at sort of a certain level before you give blood. Really, what you don't want to do is to give blood right before an important race, because when you give blood, it can take about between 6 and 12 weeks, so even as long as 2 or 3 months, for your body to be absolutely back to normal. It's making red blood cells all the time, but it is going to take a few weeks for your body to sort of make that up and get back to normal levels. So really avoiding giving blood 6 to 12 weeks before an event, but actually that time when you've done the event, that's a really good time to then, you're having a bit of a breather between events, between training for something else, then that is kind of the best time to give. Because when you give the blood, although it takes about 6-12 weeks for you to be completely back to normal, you wouldn't necessarily be aware of that, but you certainly would be for a couple of weeks after you've given it. And you shouldn't try and run really for at least 24 hours after you've donated, because that you might feel good, but actually if you try to run too soon, you can feel quite lightheaded, because you are effectively a little bit anemic. You can feel really out of breath, you can get heart palpitations, you can feel dizzy. So really, I would say leave it at least 24 hours and then see how you feel. Take it slowly, do a slow run, make sure you're well hydrated. Don't go out, on a hill session or an interval session. Just take it sort of really easy. And then after a couple of weeks, you'll probably feel absolutely fine, but you still might, as I say, not want to donate within a couple of months of doing your main event. So yeah, a little bit of sort of jiggling around, but you're healthy and you're fit and well, and they need your blood. So do it, but just think about the timing of it really, and do it after big events rather than in the weeks before. There's a lovely anecdote in the book of a friend of mine actually who had donated, and he thought that 3 days later, he's a doctor actually, he thought 3 dadays later that he would be fine. So he set off on his half marathon, and it turned out to be one of the worst runs he'd ever done. And he ended up walking about the last 4 or 5 miles, I think. So, it really can make a difference.
I remember getting told back in ancient times when I was studying that I think red blood cells last for 30 days. So is that right? You're nodding there, Juliet. So I'm relieved.
Yes, I'm nodding. Yeah, about that. Yeah.
Not saying stupid stuff. So I always figured that, all your red blood cells are turning over in 30 days. So after 30 days, you'd probably be okay. You're saying it might be a little longer than that, but guys, plus or minus, that's my logic.
Yeah, I mean, you'll probably be okay after a couple of weeks. You'll probably be okay after a couple of weeks. But, when you actually look at the red cell formation and getting back your levels back up, then it can be as long as 6 to 12 weeks to get back up. But you probably feel fine after 2 or 3. But again, if you really want to get your best performance, then it's best not to time it within 2 or 3 months of doing your marathon. So after your plan rather than at the start of it.
Let's move on to the chapter on gastrointestinal tract, your gut. I guess gastro problems are something that everybody at some stage who's a runner gets to have the fun experience of having some kind of issue. Although in between runs, I would say probably your gastrointestinal, mine, I don't know if it's everybody, but your gastrointestinal system is probably in better condition. Maybe it's because it's all the jiggling up and down when you're running. I don't know, but why does it happen that sooner or later we have gastro problems when we're running, and what can we do about it?
Yeah, again, lots of variation between people. And I think this is really important in new runners, because I certainly remember on my running journey setting out, I would have stitch after stitch, and then I would need the toilet when I was out on the run, and it just seemed to sort of send everything haywire. Those days when you're trying to think, is this actually good for me? How can it be good if that stitch pain is agony, isn't it? And I think from what what you're saying, often it's training. Often your body just starts to get more used to what you're asking it to do. The bowel gets used to jiggling up and down, and it settles into that. And also you get better at knowing what to eat and when to eat and how to fuel yourself and how long you need to wait after you've eaten before you run. And that is such an individual thing. In days gone by, I would have to wait like 3 hours after I'd eaten before I went for a run. And now I can have something like a banana or a bowl of porridge and be out the door within half an hour. So, I think it does take a little bit of gut training. And I also think that everybody is very individual as to how sensitive their gut is. I think I'm fairly lucky with a bit of a cast iron system, whereas I have friends who have a bit of irritable bowel syndrome who find it a real conundrum knowing how long to eat and getting the right foods, not on just that day, but on the day before as well, because obviously still digesting that. And when you're actually running, the blood is the priority for the blood is to go to your muscles to get you functioning. So the blood supply to the actual gut itself can reduce a little bit, and the gut doesn't like that. And that's when it can get irritated and it can cause problems. And food tends to just pass much more quickly through it, which is why runners often get loose stools, or we call runners trots, and that sudden urge to go and then have a kind of an explosive runny motion. Sorry, get a bit graphic. And it can catch you by surprise. Sometimes you think you've nailed it, you've got it all right, and then all of a sudden, out of the blue, you just have a really bad run where things hurt and your belly's not right, and you have to stop off and find a toilet and things. So I think it is a continuing sort of journey of learning and understanding your own body, and trial and error really is the biggest thing. But generally, keeping well and fit and healthy and exercising regularly will help your bowels. They'll help avoid things like constipation, if you're drinking enough fluids anyway, and keep you healthy. And we know that physical activity, particularly vigorous things like running, can reduce your risk of developing bowel cancer in the future significantly, up to almost as much as 50% in some of the studies. So however much trouble it's giving us, it's still worth keeping going.
That's quite amazing. I heard this about a month ago, and I thought it was kind of an urban myth that running protected you from cancers. So I thought, no, that's not going to be right. Now, reading your book and looking at some of the other research, it's quite amazing.
There's some really good, strong, large evidence bases that, show that all physical activity, and often the more you do and the more intense, often the results are better, but for all types of cancers. So breast cancer for women, bowel cancers particularly, the physical activity seems to be really important. In fact, at the point you're diagnosed with bowel cancer, if you are already an active person, then your survival rate is better than somebody who's inactive at the time that they're diagnosed. And also in reducing the risk of things coming back and recurrence as well, like breast cancer and bowel cancer. So it's really powerful stuff. And if you've got a strong family history of things, you can't change your genetics, but there are things that you can change, like your lifestyle and keeping physically active. So we often don't think about this when we're running. We just like the running and going and seeing our friends and having a beer afterwards and blah blah blah. But actually, we are, I think, and this is one of the things I really wanted to sort of empower people. We're making a choice for our future, and we are doing things that will improve our health, reduce our risk of being dependent on others to look after us in later life, and really making some great life choices by keeping active.
That's a great message. I love that. And along the same lines, because, the non-runners, the first thing they're going to say is like, yes, so you're not going to have cancer and you won't have heart disease, but your knees are going to be completely demolished. So what do you say to those people?
I knew that would be coming. That's always a question. And it's, it's important, isn't it? And that is the biggest non-runners' worry about running. And actually for some runners, it is still a worry. But I think the overriding message that I could say is, if you're inactive, you will have more problems with your knees than if you're active, even if you're a runner. And there's so much evidence now that not only that running doesn't harm your knees, but that running can be beneficial for your knees. There are a few caveats to this. If you are somebody who has a very poor running gait, so that you are running with really poor biomechanics and your knees aren't functioning in quite the way that they were designed to, so you've got some strange angles and things like that going on, then potentially, yes, you could cause more damage to your knees. Or if you're somebody who has another health problem that can affect your joints, then again you've got to be a little bit careful. If you are very overweight, then you're going to be putting extra stress on your joints. So there are a few sort of caveats to it, but generally the evidence is that running doesn't cause osteoarthritis, and I think a lot of the thing we're talking about here is osteoarthritis. It's that sort of what we used to call wear and tear arthritis in the knees, and there's very good evidence now that actually it doesn't cause it. It's much more to do with your genetics, much more to do with your family history than how much you run. If you run excessively year after year, miles and miles and miles, and you don't allow your joints time to recover and to repair and to heal themselves, then yes, you can. There's always too much of a good thing. But for most recreational runners, they can be really confident that it's not going to give them arthritis. And actually, if they develop a little bit of arthritis anyway, that it can help to maintain good knee health, can help to maintain the flexibility and the mobility, and even reduce pain in people who have already got osteoarthritis. And they say there's growing studies and evidence for it to be able to say these things quite confidently now, whereas before it was a bit we don't think so. They all seem okay, but definitely there's good evidence that it can be beneficial and not harmful to knees, so we mustn't get too worried.
That's good. dismissed the issue. So we just need everybody to listen to this podcast now, and then we don't have to talk to our family about how our knees are every time we meet them at Christmas, and
we can just reference the podcast every time.
Yeah, I mean, you want to take care of them. You know, you need to look after them. You need to make sure you've got a good running gait. You need to make sure you've replaced your trainers, that maybe you do some off-road as well as just pavement running, so that you've got some softer impact, and make sure that you do strength and conditioning, so you strengthen the muscles around your knees, because by doing that, you'll take some of the impact off the cartilage and the deeper structures of the knee if the muscles are strong. So, you know, it's important for people to listen to that bit of the podcast as well. We've got to look after our knees and respect them and give them recovery time, and do all those extra things to look after them as well, for them to serve us well.
Yeah, I guess to balance up the discussion, runners get injured a lot. There's a high frequency of percentage runners that get injured during any one year. I think it's, you know, quite high. It's sort of up to 50% or something.
It is, yeah.
Some of the studies.
Yeah.
So what's going wrong, and what can we do about that?
Yeah, that's a good question. And you're right. I read some of the studies that were saying up to 50% of runners have some kind of injury during the year. I think some of it is genetic. Some of us are more prone to injury than others. So, and we can't change our genetics, but some of it is to do with our running technique or our running style or the way we're training. It's easy to get carried away and do too much, and maybe not always having that respect for our body. And also sometimes runners just run. And I think you're missing a trick there if you do just run and you don't do anything else, because you will be using the same muscles in the same range of movement sort of repeatedly over and over. And you can really make significant difference to your running by thinking of your body a little bit more holistically and looking at what other things you can do to work other muscles and to keep your body strong and conditioned. So I'm a big fan of adding in some strength work and body conditioning. And I know a lot of the time we just don't do it because we just would rather go running. But I think if you are someone who does get repeatedly injured, then it is definitely worth looking at that and seeing, could it be that if you did some Pilates and you strengthened your core and then a strong core, pulled everything else into line, that you know, things have a knock-on effect. So I am a big fan in terms of injury prevention, especially as we get older as well. You know, I think our bodies do need a little bit more care, and they do need a little bit more time sometimes for recovery. So sometimes we have to accept that maybe we need an extra rest day a week, maybe we don't, but things do change, and I think we do need to respect our body and look after it. And there is generally reasons if people are getting injured. Maybe they're going back too soon before their injury is properly healed, or they didn't get that injury diagnosed and they thought it's one thing and it actually turns out that it's another. So I think being well informed and getting help with niggles and making sure injuries are really well treated, but then also digging a bit deeper. Are there imbalances in your gait? Are there simple exercises you could do to strengthen those muscles to repair imbalances, and eating well, so we've got the right building blocks for our body to repair, and then looking at our recovery as well. Sorry, that was quite a long answer to the question.
Oh no, that's okay. That was it was very good. It was very complete. And so I just have one question, and it's more for my partner. He often gets kind of like I'm going to call them shin splints, because that's really what the symptoms seem like. So why do they happen, and how do you get rid of those? Because they seem to just kind of come and go, and, you know, they're always sort of there in the background, just waiting to come back.
Yeah, so pain in the shins is quite common in runners, common in beginner runners, but also common in runners who are trying to increase their distance, their frequency, their sort of intensity of running. And to be honest, nobody really understands shin splints, don't actually really know what they are. So this is different from stress fractures. Shin splints, there's no break in the bone. I think it's important to be clear about that, because people often sort of confuse the two things. And really, we think that there's some kind of process going on because of stress in that area that causes some trauma to either the surface of the bone, the periosteum, which sort of coats the bone, or the tissues around the bone. And because when they've done studies and they've put sort of people through MRI scanners and things, they haven't really seen massive changes in that would account for the pain and the tenderness. It's often very sort of tender. So they do seem to be related to overuse, potentially to inflammation in that area. So I think, and it's difficult to actually pin down exactly what they are, but because we know that people are more likely to get them if they overtrain, or people are more likely to get them if they do make a big dramatic increase in the load and that they're putting on their legs. So kind of then sort of dialing it backwards from then, you can sort of look at the things that would put you personally at risk from getting them. Treating them is tricky and often involves actually trying to reduce any inflammation that might be there. So ice packs after you've run is a really, really good simple thing that we can all do. But I think also allowing enough time for recovery, because I think that's one of those situations where we perhaps don't give it enough because we're desperate to sort of get back out there. And you really need to wait until there's no pain, there's no tenderness. You can jump up and down on the spot and you're not feeling pain. You can walk freely without any discomfort before you then start trying to get back into it, which sometimes, can take quite a few weeks. And that in itself can be quite frustrating. But if you go back too soon, then you often just end up in the same place again. So I hate telling runners to rest, but I think that is one of those situations where cross training can be really helpful. If what you're doing isn't hurting your shins, then it's probably fine to carry on. So by all means, don't do nothing, but look at other ways you can cross train. And then again, looking at, is there anything underlying this? Yes, looking at your training plan and making that sensible, but actually, could it be worth going to see a physiotherapist or somebody who can actually look at the way your feet are landing, the muscles that you're using, your gait, and seeing if there's anything else there that could be done to improve things, as well as looking at your good shoes. And they may come up with things like strengthening your calf muscles, because that is often one thing that people with shin splints have, weaker calf muscles. So, but for those kind of things, you probably do need someone an expert to actually have a look and see, is there anything else that's going on that might be making them come back time after time.
With respect to your partner, it's probably too much bike riding. He needs to ride a little bit more.
Needs to do more running.
Bike ride a bit less.
Cross to the dark side.
Yeah. There's a chapter. This is not my question really, but I should throw this to Liz. But there's a chapter on the reproductive system, which is pretty cool. But I think the one take-home message I got from it is, I'm really glad that I'm a guy, because other than a bit of chafing in some interesting spots that you need to avoid, that kind of almost covers it. And ladies seem to have all the problems in terms of challenges with periods and possible pregnancy. So there's a whole bunch of stuff.
Maybe we can start with the pregnancy, because, I feel like running through pregnancy is one of those things that seems to be so polarized. You'll have, I had a teammate whose gynecologist, when she got pregnant, so she was training at a pretty high level, but she told her to stop running when she got pregnant, that it's not good for the baby. She didn't stop running. She just stopped telling her doctor about it. But she was very sensible. She didn't push when she didn't feel like it, and, that kind of thing. So she was very good about it. But then I had another teammate, and her doctor said it was okay as long as she, listened to her body and all that. And even in the general population, you'll have sort of two reactions to seeing a pregnant woman run. And so you'll either have the reaction where people will be like, oh, wow, she's running while she's pregnant, like such an inspiration. Or you'll have the complete opposite where they're like, oh, she's running while pregnant. That's so irresponsible. So which one is it?
Yeah, definitely. Well, I think starting with it again, with sort of the disclaimer bit, if you like, for the majority of women with uncomplicated pregnancies, running in pregnancy and physical activity in pregnancy is not harmful. That's the override. Of course, there are always going to be women who have issues with their pregnancy where running will be unsafe for them. And so I think it's always good, if you're unsure, to speak to your doctor or your obstetrician or your midwife to make sure that things are okay for you, because there are a few situations where it wouldn't be recommended. But for the majority of women with normal pregnancies, uncomplicated pregnancies, the benefits are great. And there is so many myths around this, which are slowly, I think, being dispelled. There's a lot of education, and there's certainly a lot of work going on in the UK to make it much more acceptable. And I think the key here really is, or two, is what you were doing before you were pregnant. So if you were already running and training and you were experienced, then there isn't really any reason for you to change. If you are inactive, then it's still beneficial for you to start being active, but you might not want to start with running. You might want to start with walking and gradually building up. But definitely being active in your pregnancy is beneficial to the mom, it's beneficial to the baby, it reduces lots of complications, as well as all those annoying pregnancy niggles like backache and swollen feet and things, which can be improved by exercise. So if you are running and it's uncomplicated and there's no reason for you not to be exercising with high intensity, then running's great, and it's really much more about what you feel comfortable with. There comes a time in pregnancy where women sometimes they start off with the intention they're going to run right the way through, but when the bump gets a bit big, they feel uncomfortable, it pulls, it's not they feel self-conscious, it actually is just genuinely uncomfortable, and they become a bit clumsy sometimes later in pregnancy, and they don't necessarily feel safe, especially on tricky road trails or off-road. So they often listen to their body and choose an intensity or a route which feels good for them. And I think that's the most important thing really, is for women to not worry if they can't do what they did before. Yeah, so if you are somebody who is already active and running plenty, there's no reason really for you to change. The only thing I would say is that the focus really changes from increasing your fitness to maintaining your fitness. So you don't want to be necessarily pushing your heart rate really super high, but exercising and keeping it at a more constant level is going to be great. So a really good rule of thumb is whether you can chat. If you can chat when you're running, you can be confident that you're at a level where your body can sustain it and can maintain. So rather than looking at those harder sessions, rather than trying to increase your fitness, maintaining your fitness is the best bet really. So you can take your time, and you can chat with the friends, etc., and keep still very more social running, but you probably don't want to be training for a particular event and really trying to push your fitness. So obviously people who are elite athletes and have very personal coaches who are watching their every move and recording, etc., may give different advice. But in this book, I'm kind of looking at the average sort of recreational runner. There are things you can do to make yourself a little bit more comfortable. There are kind of running bands and belt things that you can put around to try and stop your bump jiggling around. But ultimately, women are sensible. They want to do what's best for them. They want to do what's best for their baby. And they tend to know. They tend to slow down when they need to. They tend to reduce the length of their sessions. They tend to take things a bit more easy. And there comes a point for some women that when they just think, actually, I'm not comfortable now, and they stop running. So generally women know what to do if they're tuning and listening to their body. But I would say maintain rather than try and increase, and see how you go. Don't have any expectations. It can be really damaging to set expectations for yourself and then not meet them because you feel like a failure. But when it comes to looking after your unborn child, women generally are spot on, and they know what feels right. Keeping hydrated, taking it easy. Yeah, let's change the narrative.
Good. That's great. Let's hope that starts to be the new norm, is that people just are kind of, they see a woman that's pregnant running and it's not anything to criticize.
Yeah, in the UK, we have some national guidelines for exercise in pregnancy, and they are exactly the same as the guidelines for non-pregnant people. They still say 150 minutes of moderate intensity activity every week, strength exercises a couple of times a week, reduce your sitting time. They just say, listen to your body and take care not to bump your bump. And that I think has given healthcare professionals anyway the confidence to be encouraging women to be active. And if there are complications, then obviously your advice might be a little bit different.
So I guess the next logical topic would be after having the baby, because this is when this normally happens. But if you run with other women, oftentimes you'll hear like hear them mention about, leaking urine while they run or when they laugh or those kinds of things. And oftentimes they attribute it to, oh, it's been like that since I had my kids, or since I had my, my first child or my second child or my third child. And we kind of tend to take this as sort of just like, well, it's part of being a woman. This is the way it has to be. But you mentioned in your book that although it's common, it's not normal. So what can we do about this?
Yeah, absolutely. Common but not normal is the key. And as many as 1 in 3 or 4 women experience urinary incontinence. And some of it, as you say, is related to childbirth, but for some women it's not. Particularly as women get older, it becomes more common. And that is in women who have had children or not had children. And you even do get it in youngsters as well. So the fact that it's common but not normal is really my way of saying that you shouldn't have to suffer. And there is plenty that can be done to improve things. And it's a big, big barrier for women and running. It stops lots of women from trying running because they know it's sort of a high impact exercise, but it also puts off many people who have been long-term runners and suddenly find that they leak in urine when they're running downhill, particularly, or when they're sprinting, particularly, that it puts them off and it stops them wanting to do it in the first place. So I think this is really, really, really important. And again, it's one of those taboo topics. There's so many of them that I cover in this book and in my first book, all the things that nobody else wants to talk about. And I think that women should get help. Yes, you can start yourself by doing pelvic floor exercises and trying to improve the strength of those pelvic floor muscles that support your bladder and your bowel, because some women have fecal incontinence as well. But actually doing those, if you're doing those regularly and doing them over a course of about 12 weeks or so, and it's not made any difference and your symptoms haven't gone away, then you should get an expert to see you. And the right expert would be a women's health physiotherapist, because this is what they're trained in, to look at the issue, to look at, again, sometimes the position of your body, the way your posture is when you run, how your feet hit the floor, the angle of your hip, all those things that can happen in running can be relevant. Are your glutes weak? That's a big one. Weak glutes often, plenty of runners have weak glutes, but we know that weak glutes can actually make you more likely to have urinary incontinence as well. So it's a complex thing, and getting an expert to see you, to help you, supervise you with the pelvic floor exercises, and then to give you further treatment after that if they haven't helped is really crucial. And it's something, we need to shout loudly about, because many women are wearing black leggings and rushing off to the toilet, in the middle of races and things like this. So it's a big, big issue.
And I guess those glutes are very important. It seems like the glutes are one of the things that come up a lot in the book. It seems to be,
runners have hopeless glutes.
Like, I'm obsessed with bottoms. Yeah, I do mention them a lot. I do mention them a lot in this book.
But in general, I think we hear about them a lot because, I've had plantar fasciitis and I've had some Achilles issues in recent years. And that too, I watch all these YouTube videos and they're always like, well, it could stem from an unstable pelvic area. And so, it could be that your glutes are weak or not firing at the right time or not stabilizing the right bones. So it seems like they come up a lot.
They do. I mean, I think that they're the biggest muscle in the body, so we're doing ourselves a disservice if we don't use them, because there's so much power in them. So, and because of our sedentary lifestyles, because we do so much sitting, we're all developing sort of weaker glutes. And why not use them if we can? And not only will it give us power, but that will also help, like you say, to correct lots of postural things, which then can have a knock onto our technique and our running health. So definitely fire up those glutes.
And I guess the bottom line is, we need to engage with doing the exercises that are part of the solution. The problem with runners, I think, is we like to run. We don't want to do all that other stuff. No. I just want to put my shoes on, go out the door and start running. And when I finish running, stop. And increasingly, I think, we're getting the message that, you need to do other things, and don't accept that, when I can't run because I have an issue, that I need to stop running. No, you need to address the issue, and you address the issue through non-running means, often strengthening exercises, or, in the case of leaking urine, maybe it's pelvic floor or strengthening exercise, Pilates or something. In the case of my knee problems this year, it's sort of glute strengthening exercises and a bit of resistance work. And by engaging with those other things, sometimes it could be diet. By engaging with those other things, you can get back into your running and get all the benefits off your running, instead of saying, well, I just want to run. Now I can't, so I'm going to stop. Then you're not going to get the benefits of all the protection that running is going to give you in your older years.
Yeah, definitely. Yeah. I mean, I want to be one of those 80-year-old women, at the London Marathon. And I know in order to do that, what I do now is important. So I'm increasingly, maybe I'm just getting older and wiser, but I'm increasingly seeing that small things that you do daily now make a difference for your future. Even if you don't really want to do them, you'll be saving yourself time and energy, and enabling you to be a healthy runner for many years to come, if you can just devote a little bit of time and effort to doing some of those things that you don't necessarily want to do.
So in your book, you actually mentioned that weight doesn't indicate health status. So I guess the first question is, what do you mean by that?
Yeah, so I think that what I'm trying to say is that you shouldn't judge people. You can't look at somebody and know how healthy they are by the way that they look, because what you see from the outside doesn't always reflect what's going on inside. And one of the big markers of future ill health or high disease risk comes from having lots of visceral fat. And visceral fat is the harmful fat that sits around your internal organs. So around your heart, around your liver, and actually in your skeletal muscles a little bit as well. And that internal fat causes inflammation in the body, and that increases your risk of developing diseases like cancer, type 2 diabetes, heart disease, etc. But you can't necessarily tell how much of that harmful fat somebody's got by looking at them. If somebody has a very large waist, then it's likely that they will have an increased amount of that visceral fat. But you can also be somebody who looks quite slim, who doesn't look healthy on the inside and does have quite a lot of visceral fat. So really what I'm trying to say is that you can't assume that somebody who is slim doesn't need to look after themselves by exercising, because exercise is really good at reducing visceral fat. It's really responsive to exercise. So if you exercise and you reduce the amount of visceral fat you've got, you reduce the inflammation in your body, which will reduce your risk of various diseases. Now you could be somebody who was slim, didn't do much exercise, but had a lot of visceral fat, and you could have a high risk of disease, compared to somebody who is heavier and more overweight than you are, but has lower levels of visceral fat and exercises regularly. So I really sort of wanted to sort of just try to dispel some of the myths there, that you can be fit and fat, if you like. That's the sort of phrase that people say, and that we just mustn't judge people, and that physical activity and running is good for all of us. And we shouldn't just use running in terms of weight. Many people start running because they want to lose weight. That doesn't always work, because running makes you very hungry. And also, it just doesn't always work. And it can be very, very, make you feel very despondent. And in a way, we should almost separate entirely the benefits of running. Yes, it might help some people lose weight, but actually, regardless of that, it's still doing us good, because it's helping to reduce that internal harmful visceral fat that will make us healthier. So some of the benefits of exercise are to do with weight loss, but many of them are completely independent of that. And I think we just need to sort of change how we look at people, and how we do tend to judge, and we shouldn't.
And I guess that goes along with the first chapter where you're about mental health, and that, the scale might not be at the number that you want, but you're still doing something positive for your mental health.
Absolutely. Yeah. I mean, those mental health benefits are there for everybody, aren't they? Regardless of size, shape, weight, fat levels, etc. The positive psychological benefits are for absolutely all runners and non-runners.
I think a note for anybody who's thinking of going out and wonders how people regard them, what will people think of me if I'm out in my running gear shaped like this? My attitude, and I think a lot of people that I know who run's attitude is, if you're out there and you're running and you're making an effort, or you're doing walking and you're in your running gear and you're out there doing it, you go, power to you. And our reaction is generally, if I could speak for the whole running community, our reaction is, you're a runner, so you're one of us. And what you look like is irrelevant, because lots of runners are nerds and introverts anyways, so they're kind of less slightly weirdos anyways. So why would they worry about what somebody else looks like? And I think if there's anybody listening to the podcast who's thinking, I feel really self-conscious, just get out there and do it. Actually, everybody's rooting for you, and everybody thinks that you're great for doing it.
Yeah, I would second that. Yeah, definitely. The running community is very welcoming and accepting. And like you say, most people aren't looking, if they look at you, they're not looking at you thinking, oh, she looks silly, or he looks silly. They're looking at you thinking, good for you, go on. Yeah. And sometimes they don't say anything because they don't want to sound patronizing, but that's what the majority of people are thinking. And once people get over that and they realize that, then they think, why didn't I start earlier? But the problem is speaking to those that don't do it and trying to convince them that that's what other people are thinking. It is a real barrier. And I have plenty of women, I can think of two immediately in my very close sort of running circles who only ran in the dark to start with. They started their running journey a very early morning or very late at night in the dark, so that nobody could see them running because they were too self-conscious. And that, I'm glad they did it, and now they're running in daylight and is great. But it's sad that that's how you feel when you begin, that it's something to shout, to be proud about, and not hide. And yeah, it's a lot of it's in our mind, isn't it? What we think people are thinking about us.
Yeah, just an aside, sometimes when you see somebody looking at you when you're running, it's because it's a runner that's injured, and what they're thinking is like, that's not fair. How come she gets to run and I don't?
Yeah.
So I guess a kind of a follow-up question would be this notion that, once you get really fit and you start to have all these training goals, you hear it very often, the power to weight ratio is, is great for performance. You have to reduce your weight so that you can perform better. What would you say to that?
I'm less and less looking at what the scales say and much more focusing on muscle. To have speed, to have power, you need muscle, and muscle is going to weigh more than fat does. It's almost, particularly as people age, and by aging, I'm meaning after the age of about 30, our muscle mass is gradually reducing. It's just natural. That's what happens, particularly after people, and women in particular, around the menopause after the age of about 50, that speeds up a little bit. So I'm increasingly aware how important muscles are. And when you use a muscle, it releases myokines, and myokines are anti-inflammatories, and they zoom around in your circulation and reduce inflammation. And as I said, with the visceral fat, that's that inflammation in the body that increases our risk of disease. So actually, when we use a muscle and we get the myokines, it has an anti-inflammatory effect, and then that reduces inflammation in the body. So really, we want to gain muscle, and we want to build muscle and maintain the muscle we've got. And if you're looking at building power and speed, then you need muscle. And so in a way, the scales become irrelevant. And what's more important is how you're building muscle, but also that you're consuming enough calories to fuel your activity as well and fuel your exercise, that you've got the right vitamins and minerals to do the repair jobs when you're resting, so you can rebuild the muscle and the bone, etc. But also, it's very easy to slip into negative calorie deficit. And I do mention in the book a condition called REDS. I'm not sure if you've heard of that. So relative energy deficiency in sport. Yeah. And it used to be thought this was just a thing affecting women and giving them lack of periods and things, but we now know it's much wider than that. It's not just talking about eating disorders like anorexia or bulimia. It's actually talking about anybody who isn't consuming the right foods or enough of the right foods to fuel the exercise that they're doing. And if you're constantly in energy deficit, then that will have a knock-on effect to your performance. So not just your performance, but your ability to think, to concentrate, your moods, your digestive system, your bone health. For women, it can affect their menstrual cycles. So it's a really broad picture. So there's a fine line if you are trying to reduce your weight to improve your performance, that you can easily slip into energy deficit, and that again will have a negative effect on your performance. So it is, if you're looking along those lines and you're really looking at marginal gains and high level stuff, then I would really recommend speaking to an expert, a dietitian, to making sure that you're doing it safely, and that you're not actually accidentally, unintentionally harming yourself.
We've seen with Red S, and particularly in high level training of females, it's been very well publicized recently in the US in particular, the detrimental effect it has on people who are pushing themselves, who feel they have to get to a low weight to get high performance, and the sort of negative consequences it's had on bringing forward top athletes from the female ranks, because in the US they start very young, highly competitive, and all the juniors who are the top juniors in the US end up not converting to be the top professionals. There's quite a fall away because basically training programs are wrong, or have been wrong. Yeah,
there's a lot of pressure on those some of, I say girls, because a lot of them are, like, say, still girls, and that's a time, you reach your maximum bone mass, and bone health is one of the big problems that some of these women are having. You reach 90% of your bone mass by the time you're 19. And then you get to 100% by the time you're 30. So if during those times you've had any issues that have affected how strong your bones are, then you're never going to reach a good peak bone mass. And then after 30, it starts to reduce. So some of these women, what happens is that they're because of the energy deficiency, their body stops having menstrual cycles, and then that affects their hormone balance, which affects their estrogen levels, which affects their bone health. So they end up with osteoporosis, which is very thin bones, or osteopenia, which when they're a little bit thin, but not as thin as osteoporosis. And it's very hard to make that up. So a lot of these things can be long-term issues and problems. So it's sad. It's great that that awareness is increasing, and so a normal period is like a marker of good health. But women who are using the contraceptive pill, where they're having either none or very intermittent periods, they don't know whether they've got that normal cycle. And that's been the issue for some of the runners that I've spoken to, is that they were using a contraceptive pill, so they weren't having periods, and they didn't know that that their body wouldn't be having a regular period if they weren't on the pill, and that potentially their bone health was at risk. So they feel quite passionately about highlighting that danger. And like you say, it's intense, and they're young, and we need to not harm them. We need to do everything we can to give them a good, long, healthy life as an athlete and as a non-athlete beyond that. So yeah, really important.
Well, I think change is coming, and we see it coming through. So let's keep our fingers crossed for continued progression.
Yeah, I'm grateful for those that are sticking their head up and hand up and telling their stories.
And some of those were on our podcasts. So if you want to go back and listen to,
I will.
Was it Girls Running? Is one of the ones we did with Melody Fairchild. Which was,
they talk about that
from that point of view.
Yeah. Maybe we can finish on a bit of a lighter note. Alan has some questions about blisters, because that's a common problem.
I guess blisters are something that everybody has who runs sooner or later. It kind of comes with the territory eventually. And it was great to see the chapter on skin, because it's amazing to look at skin when you explain it at the start of the chapter, what an amazing organ it is, how it works. And it never ceases to amaze me, as somebody who's been interested in human biology, physiology. It never ceases to amaze me how absolutely mind-bogglingly incredible the human body is, and the skin just goes to emphasize that. But let me come back to blisters. Everybody always gives you the advice with blisters, it seems to me, to don't pop your blisters. And I get that, because basically your blister is sort of a detachment of one layer of your skin, and there's some fluid forming underneath, and underneath it's all kind of sterile. And if you pop it, you're giving yourself a chance for an infection. I guess that's what the rationale is. So I kind of buy into that. But the trouble is, often when a blister comes up, if it's got fluid inside it, it hurts. And I think it hurts around the outside of the blister because the pressure of the fluid is pulling your skin apart. Like inside, it's pushing on layers and teasing it apart. And then you get soreness or inflammation or pain around the outside. And I often find that at that point, if I pop the blister, the pain goes away because it takes the pressure off. So my routine tends to be, if it's hurting, to pop it, put some antiseptic cream over it and cover it up. And I find I get a better result that way. But every time I read something, it always says, why are you popping your blisters? So I feel really guilty because that's what I do with my blisters. So help me out here, Juliet.
Yeah, so I'm a non-popper as well. Although I think there are situations when you have to pop it. You know, if you're on a multi-day event and the pain is excruciating, and like you say, as soon as you pop it, then you relieve the pain, and you can sort of carry on. But yeah, ultimately, I try to work with my body, and I sort of think it's created like that for a reason. You know, there's a cushion on it. With the fluid is, like you say, sterile, so it's creating this nice little greenhouse, if you like. Maybe that's not the right word, but this sort of sealed unit where healing can go on, where the germs can't get in, and there is the cushion of the blister. So generally, I'm of the non-popping camp, and yeah, they do hurt, but they eventually shrivel up and go. And if you've got an infected blister, then it can hurt for a lot longer than a normal blister while it's healing. So that's my kind of rationale. But there are times when the right thing to do is to pop it, but obviously it's popping it with trying not to introduce any infection to it. So using like a sterile needle, so that you're not just inserting something which is dirty, like the blade of scissors or something, or just snipping it with a pair of nail scissors or something, because people do, and like you say, putting some antiseptic on and then covering it with something to keep it sort of protected and infection free. So there are situations when I would pop, but generally best thing is not to get them in the first place. And then if you do get them, I am a non-popper unless I have to. So sorry, that's maybe not what you wanted to hear.
No, it's helped. It's helped a little bit to relieve my guilt.
Yeah, Alan has decided that he had to pop those. It was necessary.
Yeah, that's
fine.
And
as you say, multi-day events, it's usually where I have the problem. You know, you've got a blister and you've got to run again the next morning. There's no option. You've got to go. It's on a sensitive spot and it's hurting.
Yeah, you're doing what you can to do it hygienically, and taping it up and covering it afterwards is the best that you can do in those sort of situations.
Yeah, because I guess that fluid in your blister is an extremely good growth medium for bacteria, because it's sort of probably full of juicy nutrients that bacteria would like to get into.
Yeah, and they tend to happen in blisters in warm, moist, dark places, and germs love that. So
and on your feet where there's dirt as well.
Yeah, definitely.
Great.
Okay, so that's put me in a good place with respect to my approach to blisters, I think.
Just to sort of end things, were there any questions that were kind of like just big questions that you wish you had included, but you didn't include, either because they didn't make the cut at first, but then later on you thought that it would have been a good addition, or that they came up later and you had just forgotten? Is there anything kind of really big that stands out that you think you could have included?
I don't think there was anything massive. As I say, bunions. I didn't put bunions in, but I think what I struggled with at times was what's medicine and what's training. I'm a group leader for a running club, and I lead groups of women. I'm not a sports physiologist or a highly trained running coach. I do coach some women, but so I needed to just make sure that I stayed within my area of expertise and that it didn't get too technical in terms of training. What I wanted to create was a sort of a useful handbook for all runners that wasn't intimidating. And I think occasionally I talked about VO2 max in it. I think there's stuff about things like heart rate variability and training and heart rate zone training where I could easily have got quite involved and had lots of questions on that, but I was trying to sort of just take a step back and think, what is this? What I'm wearing for this is my GP, my doctor hat, and not those other hats. Yeah, so I think that was the thing I struggled with. So if there were any big areas, that was probably things that shouldn't have gone in, and trying to keep it true to what it was.
Okay, that's fair. And if people want to follow you, to see what you're doing or see if you've come out with any other books in the future with all the questions that didn't make the cut to this book, where can people follow you?
Oh, thank you. Best place to go is just to my blog, because all my socials and everything are on there. And my blog is drjulietmcgrattan.com. And the front page at the moment is all about this book, Run Well. And there's a blog and there's all the other bits and pieces that I'm up to in the menu. So that would be great.
I saw the references to the 261 Fearless Global Women's Running Network or Fearless Running Club. What's this, Juliet?
Oh, I'd love to tell you about that. I'll try and do it quickly for you. So I'm not sure you've heard of Catherine Switzer. She was the yeah, of course, yeah. Some people haven't, so I've never assumed. Boston Marathon 1967. Her bib number was 261. People tried to throw her out of one race director tried to throw her out of the race, but she carried on. And in years to come, women were writing to Catherine and saying, I write 261 on my arm because it makes me feel fearless before I go to a job interview, or I've got it tattooed on me. And I think it was when the tattoos started that she thought, I need to do something with this. So she teamed up with a friend of hers who was an experienced running coach and businesswoman, and they founded a nonprofit based originally in the States. And the main aim of this was to empower women through running, because as you know yourself, once you run, you realize what other things you can do in life. So the main focus of this is running and education and non-pressured, social, non-competitive running clubs for women, particularly targeting women who are inactive and helping them into running, but are clubs where all abilities can run together without training for things, without setting pace time, without, much more, as I say, social running, but also the 261 coaches are trained in running for women. So what's different about the female body? What different things can they look out for in terms of their pelvis, the angle of their legs, running technique for women, how to overcome some of the barriers, we've talked about in pregnancy and periods and menopause. So it's very much a women's specific run training. So I help on a global level. I'm their women's health expert. And I'm also a master coach. So I train the coaches who lead the local clubs. And I'm also a coach myself at our local club. So and also in the UK, I'm the director of the nonprofit here in the UK, along with my co-director, Lisa Ruggles. So it's a growing, it's not a movement, it's a network using running to empower women. And we have clubs in all over the world, 5 continents. So some of the most notable would probably be those in the Democratic Republic of Congo, where running is not normal. India, Albania, one starting now in Ecuador, a new one in Israel, New Zealand, Zambia. So and in the US too, obviously. So it's a wonderful thing to be part of, and I'm really proud to be part of it, and it ticks a lot of my boxes in terms of what I think running can do and in improving health and equality, and just trying to get the message out there and overcome those barriers, and so women don't have to run in the dark.
It's absolutely fantastic. I assume that people can find more about that by just going to your blog. There'll be references and connections if they want.
Yeah, there's references in my blog, and the global website is 261fearless.com. And there's everything on there, including Catherine's story, but also all the clubs locally. And we're always looking for women who want to lead these kind of groups, who want to do something separate away from their competitive running and want to help other women into running. So do have a look at it, definitely, because we're growing all the time.
It's absolutely fantastic.
I'll link that in the show notes.
Thank you.
Never cease to be inspired by some of the people we talk to on these podcasts. Absolutely amazing. I mean, you made a reference to Catherine Switzer. We actually had an interview with her husband, Roger Robinson, about his book. So we got some sideways insights into Catherine and her exploits.
That's a great bit. When Running Made History. That's brilliant. I bought that for my son and my husband who like running as well. So yeah, fantastic.
Amazing.
So in terms of your book, is there somewhere that you'd prefer people to go if they want to avail themselves of a copy of the book?
I really don't mind where you go. Just wherever you go, if you can leave me a little review, that would be amazing. It's really hard to get people to review books. And I know what it's like, because I mean to review lots and I don't get around to it. So I try my hardest now. I'm on the other side of it. But I don't mind where you go. Any good bookseller. There's the Kindle version, paperback, and there's an audiobook as well. So if you're someone who likes to listen to things while you run, then you can listen in while you're on the move.
That's fantastic.
And this is not your first book. Is it your last, or do you have plans for another book?
After the first one, I said never again. It's a bit like children. But I did the second one, and I sincerely hope that it's not my last, because I really enjoy the process of writing. I really do enjoy that challenge, and yeah, I've got a few ideas. So watch this space.
Okay, great. And you know where we are when you want to have a discussion about your next book. Thank
you very much. Thank you.
So I guess we'll just give a few of our own thoughts on the book. So Alan, do you want to start with yours?
Well, the book's massively researched. As I said earlier, there are references for everything. So Juliet's credibility and advice is unquestionable. Not just the fact that she has doctor in front of her name, but really the hundreds of references that she makes to the things that she says. She touches, I think, many of the key questions. I think a good test for me was, as I was reading it, I was saying, okay, a question I would have if you were asking me about this would be X. And invariably, the question that I had in my head would come up in the book. So I think it's a good sign that I think the things that you're thinking about with respect to your body and your health and your wellness as a runner is probably going to come up in the book and be discussed and answered in an easy format that you can digest pretty easily. There's a lot of interesting facts. I think nerdy facts for mostly guys. Did you know? Where you go, ooh, no, I didn't know that. That's really rather interesting, and that's quite cool. And just helps you to be increasingly fascinated and amazed at the human body. There are some good little simple biology lessons at the start, so they kind of put into context as well, how the body works. So if we're talking about skin, here's a diagram of skin and how all the things in the skin work. How do you sweat? How do you get blisters? And then you understand it super well. From that point of view, it's kind of fascinating in terms of educating you as you go about not only what's happening to you, but why it's happening. All in all, an easy read, but lots of learning and super relevant.
So along the same lines as Alan, yeah, I thought it was well thought out. It's easy to read, and it's not at the expense of being well researched. And it also included some real runner stories, which was kind of fun. So just examples of people with a particular problem that found a solution. Many of the common questions I've heard were answered, and also some questions that I'd never heard, but it was actually kind of enlightening. So I really enjoyed that. I like the organization by body system. It kind of makes a lot of sense to me because, when you study biology, that's sort of how all medical books are kind of organized. And I think also because that sort of allows for that little intro section about each system where you get a little background, but not a background that's too complex. So it's all well broken down. I think that, even somebody without a medical background would be able to understand everything that's in the book. There are very few like really long medical words. There are occasionally there is one or two, but it's always explained first. And then sometimes even referenced back. Oh, don't forget that this acronym meant this, and in parentheses, there'll be everything spelled out. The language was not too medical, but it wasn't dumbed down either, which was nice. So if there was like a diagnosis or anything like that, it was explained in layman's terms before moving on. But you got the actual name of the diagnosis. I also like the did you know sections. They were a lot of fun. I had no idea that the liver weighs 1.5 kilos. And I'm still amazed. That's massive. I didn't know that my liver was that big. And it's the only organ in the body that can regenerate, which I also didn't know. So those are a lot of fun. So if you buy the book just for that section, I think it's well worth it.
Okay, excellent. I guess we should just thank you, Juliet, for the time you spent with us today and the insights you've given us. And we look forward to your next offerings, and get over to Dr. Juliet McGrattan's blog. Check out the 261 Fearless. I didn't know that's where 261 came from, and I shall be investigating further.
Fantastic. Thank you very much for having me. It's been great to chat to you. And I'm so delighted with your feedback. It's always really interesting to have people say what they thought and the bits they liked. And yeah, it really helps me to make sure that the next one's even better. So I'll definitely let you know. And I've really enjoyed speaking to you. Thank you so much.
Excellent.
So thank you for listening to another episode of Running Book Reviews. Big thank you to the publisher Bloomsbury for providing a review copy of the book. And big thanks to Dr. McGrattan for spending time with us today. If you'd like to leave us feedback about how we can improve the podcast or want to suggest a book that you would like us to review in the future, please leave us a comment on social media. We are Running Book Reviews on Facebook and Instagram, and on Twitter, we are reviews_running. Please also follow us on social media to find out about new episodes when they're released, or you can just subscribe to the podcast on your favorite streaming platform. Bye for now.
Bye.